Mustaqim.
Hi, I'm Sika.
Hi, I'm Myra.
Hi, I'm Haja.
Hi, I'm Amy.
We are from Group 5S59.
And our topic for today is...
So, what is chickenpox? Chickenpox is an illness caused by the varicella zoster virus. It brings on itchy with small, fluid-filled blisters. Chickenpox spread very easily to people who haven't had the disease. You guys will know how to spread and how to prevent it. In this video, we will break down everything you need to know to keep yourself and your loved ones safe, from the chronology to symptoms and how to prevent it.
The disease was first documented by Giovanni Filippo and Gracia, the Italian physicians, in the 50s. The name chickenpox is thought to have come from the mild nature of the disease compared to smallpox, or possibly from the resemblance of the rash to tick visits. In the early 20th century, scientists confirmed that the chickenpox caused by the varicella zoster virus. Later, researchers discovered that the same virus could reactivate in life, causing shingles or herpes zoster. Chickenpox is spread by inhalation, and children are infectious a few days before symptoms appear. The blisters also contain live viruses that can become airborne and inhale or can be transmitted through direct contact. After inhalation, chickenpox viruses invade the cells of the respiratory tract, replicate in the lymph nodes, and are spread by white blood cells throughout the body. Eventually, they lodge in the skin, causing the itchy blisters that are characteristics of the disease. In healthy children, chickenpox lasts about a week and goes away without medical intervention. But it can be more severe in adolescents, adults, and people with compromised immune system. Infections with chickenpox typically provides lifelong immunity to reinfect.
Some of the statistics about chickenpox virus in Malaysia. In Malaysia, the varicella incident rate per 100,000 patients in Kuala Lumpur was 1.897, and the second one, in 2022, there was 51 outbreaks of chickenpox reported in Malaysia, compared to only 10 in 2021, a 410% increases. And the third one, Selangor and Kuala Lumpur recorded the highest number of outbreaks, with 26 and 15 outbreaks respectively. And the third one, and the fourth, Petaling Jaya and Hulu Langat also had high number of the outbreaks.
How's the progress on our assignment?
I think we're almost done, but we should add more point on the discussion part. Can you see the progression?
Yeah, I think we are going good, but I think on the appendix part, we should include more photos from our experiment, and the data needs to be more accurate.
Wait, is this? I don't think this point is related to our experiment. We should add more point on this part. I think we should.
You moose, what is in your hand?
It's so gross.
What's that?
Oh, I think it's just some sort of allergy reaction or something, because last night I had peanuts as my supper, so I think it will be gone in a few days.
Are you
I think.
sure? It looks bad.
No, it's just a little rash, so I think I will be fine. Yeah, just a mild rash, nothing more.
Menggunjing orang itu sarang dosa, mengganggu orang itu sarang dosa, mencaci orang itu.
Hey guys, glad that we submit our assignment on time.
Yeah, maybe we should grab some lunch.
Yeah, let's go. Hey wait, what's wrong with your face?
It's getting worse. I think you should see the doctor first.
I think it's just some regular allergy. I think I have some cream at home, so I would put it on my face, and I have some anti-allergy medicine, so... No, don't worry. It's just some regular rash.
Okay.
I will probably be fine.
I'm heading back first, guys.
Me too. Bye.
Bye.
Okay, bye guys. Seriously, you don't want to meet the doctor?
Yeah, I'm totally fine. It's just some regular rash. It could be gone in a few days, I think.
Oh wait, isn't that Dr. Maria? We should go ask her some questions. Hi doctor.
Hi.
Can I ask some questions?
Yes, what is it?
Is it true that my friend is just having an allergic reaction?
How many days have you been having this?
I think it's around a few days, but I think it's just some regular itchiness, some rash.
How about we talk about this at a more proper place? Let's go have lunch.
Alright.
Okay, so based on what I'm seeing, the blisters and the rash, I think you are having chickenpox. Have you been, I don't know, somewhere unsanitary in the last few days? Notice you've been scratching and you also have some rashes. I think you also had the chickenpox. Have you been hanging out a lot with them?
Yeah, I think in the past few days we're having hang out to do a lot of assignment together.
So I think you also caught the chickenpox. It is easily contagious through water or shared items. So it is fairly easy
No
for you
wonder
to
I've been itchy in the whole time.
So I think both of you need to go to bed rest first a lot, and don't forget to get a cream for your rash, and do not scratch them. It will make them worse. One more thing: avoid contact with anyone, as it is. I fear they will also catch the chickenpox.
Okay. Alright, thank you, doctor, for the advice.
Thank you, doctor.
So, the symptoms of chickenpox are fever, which are only mild to moderate fever, and also itchy rashes, and then fatigue and weaknesses, which are feeling discomfort, and also the loss of appetite, which are decreased desire to eat, and then headaches, usually it only mild to moderate headache, and the last one is body ashes, which are muscle pain or discomfort.
One of the most effective ways to prevent the spread of chickenpox is through vaccination. The VZV vaccine is highly recommended and effective to be taken by people who haven't got the chickenpox. It is a weakened and live version of the virus that is administered through the body to help to build the immunity system. So by taking the vaccine, we can help to build the immunity surrounding our community and help to prevent the further spread of the virus. Second, we should limit our exposure and practice social distancing with people who had the characteristic rash. We cannot share our individual items with people that is infected, such as towels and clothing, as the virus is highly contagious. It is also worth noting that the virus is highly contagious for a couple of days before the rash appears. So, if we have some people that has chickenpox in our household, we need to try to isolate them if possible to prevent further spread of the chickenpox. Lastly, we should practice proper hygiene to prevent further spread of chickenpox. Wash the hands with water and soap or hand sanitizer as frequently and as much as possible in order to keep our hands clean, especially after touching the potentially contaminated surface or after getting in contact with person that is infected. Second, we should cover our mouth and nose when sneezing or coughing, as it can prevent the spread of our saliva or respiratory droplets. And lastly, we should disinfect the surface that is potentially contaminated with people that has chickenpox as regularly as possible to prevent the virus from getting everywhere in our house.
For those that have experienced it, the worst thing about chickenpox is the uncontrollable itchiness. Most people, they use rash cream and antihistamine to control the itchiness and the discomfort. There are also people that take a cold bath and it can reduce their discomfort and this itchiness. We also have to make sure that our nails are kept short when we have the chickenpox, so that we can avoid secondary infection and also reduce the risk of scarring. The most important thing is for us to take a proper rest and properly hydrate ourselves.
Let's spread awareness, not the virus. That's all from us.